Imagine being in an intimate moment and watching your partner experience something you have never felt. Not pain, not discomfort, just nothing close to what they describe. And you smile because you have been smiling through it for years. If that resonates, this video is for you. And hear this first, there is nothing wrong with you. The inability to feel pleasure during intimacy is one of the most silently carried experiences among American women. Research estimates 5 to 15% of women have never experienced orgasm. A much larger percentage, up to 40%, report that pleasure is inconsistent, muted, or absent. And most have never said that out loud, to a doctor, a therapist, or even a close friend. Because culture makes not feeling pleasure feel like a personal failure. It is not. Today, the real reasons and real paths forward. I am Dr. Lauren Mercer. Everything today is research-based. Let's go through it. Reason 1, the education gap. Most women received little accurate education about their own anatomy. The clitoris was rarely discussed. Its full structure, almost never explained. A study in the Journal of Sex Research found women with accurate anatomical knowledge report higher orgasm rates and higher satisfaction. The gap is often not physical, it is informational. The clitoris has over 8,000 nerve endings and extends 3 to 5 inches internally. Most women were never taught that. And you cannot find what you do not know exists. Reason 2, spectatoring. This is mental absence. You step outside your body and observe yourself. Am I taking too long? Is this normal? What does my body look like? These thoughts pull the brain out of the experience. Research shows orgasm requires the brain to quiet its analytical center. Spectatoring keeps it active. The thinking brain and the pleasure response cannot fully run together. This is not a willpower issue. It is neuroscience. Reason 3, insufficient arousal. The body follows a sequence. When that sequence is rushed, sensation is reduced. Without enough arousal, blood flow is lower, sensitivity is lower. Research shows women with consistent pleasure have longer arousal periods. This is not optional. It is biological preparation. Skip it, and the experience becomes limited. Reason 4, emotional safety. Female pleasure depends heavily on psychological safety. Research by Dr. Emily Nagoski explains the brain has brakes and accelerators. For many women, the brakes are more sensitive. Feeling judged, pressured, or disconnected activates those brakes. And when the brakes are on, pleasure cannot fully happen. This is protective biology, not personal failure. Reason 5, undiscovered anatomy. Every body responds differently, and many women have never explored their own response. Research shows self-exploration increases satisfaction in partnered intimacy. Not because it replaces connection, but because it creates understanding. You cannot guide someone to what you have not found yourself. Removing shame and replacing it with curiosity changes everything. Reason 6, physical and medical factors. Some causes are medical. SSRIs and SNRIs can reduce sensation. Hormonal imbalances can lower sensitivity. Pelvic floor issues affect physical response. And some neurological conditions impact nerve pathways. These are treatable, and they are worth discussing with a doctor. Here is the reframe. Not feeling pleasure is not who you are. It is information. It is your body pointing to something that needs attention. Every cause we covered has a path forward. You are not broken. You were not given the right conditions. What to do? Step 1. Learn your anatomy. Understanding your body is the foundation. Step 2. Practice presence. When your mind drifts, bring it back to sensation. What do I feel right now? Just that. Step 3. Give your body time. Commit to extended arousal. Minimum 20 minutes of full body engagement. Step 4. Remove pressure. No timeline, no performance, only experience. When pressure enters, the brain shuts down pleasure. Step 5. Seek support if needed. A sexual health therapist or gynecologist can help identify physical factors. Treatment success rates for anorgasmia are above 90%. Above 90%. If you have been carrying this quietly, hear this. Your body is not withholding from you. It is waiting for the right conditions. And now, you know what those are. Share this with someone who needed it. Comment below which reason resonated most. Just the number. I read every one. I am Dr. Lauren Mercer. See you in the next one.